like this. Very simply. As I said, use your brain. This tiny. This is that's it. You're very into introduction. Relax. Remove background.
We are starting the program. Please join us.
We are going to start the program. So, Rita, ma'am, should we start?
Yes, I think we could.
Yeah, thank you.
Dr. Mayanga Gupta.
Good evening, dear friends from India and across the world. Welcome to the All India Women's Education Fund Association, the IWAFA. IWAFA presents the fourth of the national webinar series on post-COVID-19 Community Connects, with support from the National Institute of Social Defense. The National Institute of Social Defense is under the Ministry of Social Justice and Empowerment. Our webinar today, the fourth in the series, covers the very significant topic of post-COVID-19 health and nutrition for elders, a topic that has engaged communities, non-government organizations, governments, and policymakers across the world since the impact of the pandemic post-March 2020 and since the declaration of the United Nations in December 20, the most significant declaration that the decade following 21 would be the decade of the aged. The year 2020 saw the elderly battle several fronts. Loss of mobility during the lockdown, limited mobility due to a fear psychosis continuing to this day. This impacted the health and nutrition indicators significantly. The problems were aggravated by a series of natural disasters during 2020. Floods, cyclone, flight of migrant labor to their villages, flash floods in coastal and urban areas, ensuing a loss of income for the household's breadwinner, the unforeseen impact of loss of home and movement to rehabilitation centers and camps that resulted in unmitigated hardships. For the elderly, who by definition are the last in the line for nutritious food and medicine. The problem is compounded by the fact that the elderly have no voice. Most of the elderly in the rural and semi-urban settings in particular have to work to make ends meet and to justify their existence in the household, as there is no universal social security system in India. Most of them are unskilled casual or domestic workers, mostly from the unorganized sector, who make a meager daily wage. Erosion of their power to earn, dire malnutrition, and lack of food to lack of necessities puts them on the bottom of the social ladder, leading to violence, abuse, and very often severe mental health and imbalance issues. This webinar of the post-COVID-19 health and nutrition of elders seeks to place this subject on center stage and examine the problem as a cross-cutting issue, setting out key concerns with focus on early warning of health indicators, risk reduction and mitigation, management of elders' health, strengthening capacities of elders and management of elders' health, strengthening mental well-being of elders through appropriate interventions, and strategize to optimize opportunities for better health in order to ensure social and economic participation and obviate the impact of fear, malnutrition, and social isolation, coupled with physical abuse and mental health problems. We have an assemblage of the most respected and capable speakers detailing our subject. IWAFA, I reiterate, is grateful to the NIST for supporting the webinars at a significant time when action plans for 21-22 are being drawn up. I would like to place on the table the house rules for today's webinar, and I hope you could carefully listen and also adhere to it, please. In order to ensure a smooth and effortless transmission, I would like to reiterate the webinar protocol. Kindly, to reduce background noise, disable your mics during the session. To improve connectivity in areas with weak internet connectivity, please switch off your cameras. Don't click pictures of the webinar. Recorded session of the webinar will be available and uploaded on the IWAFA YouTube channel. For the unregistered participants, kindly register at the link provided in the chat box by our team. To help us plan and schedule better programs for you, please fill the feedback forms, which will be provided at the end of the session. Participation certificates will be provided to all of you once you fill in the feedback form. Kindly send in your questions in the chat box addressed to a specific panelist or in general, whereafter we will select the panelist or I will reply to your questions or Dr. Mayanka Gupta will. Thank you very, very much for your cooperation. Friends across the globe and from the country, before going further, we would like to invoke the grace of the higher being, the higher authority, our gods, and begin the program on this very significant fourth day of our webinar series by a virtual lamp lighting. I request you all to join on this occasion by participating in the auspicious lamp lighting. I would now like to invite, once we are through with the lamp lighting, my president, Ms. Asha Chandra, the president of IWAFA, for her welcome address. An advertising professional, Asha's expertise spans multimedia platforms. Having worked with the world's leading advertising agencies, J. Walter Thompson, Ogilvy and Mather, and as a short filmmaker and writer, she brings a target-oriented, all-encompassing approach to the social sector. With her commitment, the IWAFA has seen very great heights. The president of the 92-year-old All India Women's Education Fund Association, Ms. Chandra has been the governing body chair of the Lady Irwin College, founded by IWAFA in 1932. Adapting to the new normal of the coronavirus has become the need of the hour, and IWAFA embarks on this journey with online programming for the subject, with a great deal of support, push, as well as determination of the President, Ms. Asha Chandra. I invite her now to speak, welcoming all the participants from India and across the globe for our most important fourth webinar. Asha, please.
Thank you so much. My dear students, colleagues, friends, participants from all over the world. It is indeed my honor, privilege to welcome you and our distinguished panelists for today, the fourth webinar in the series Community Connects. Dr. Virendra Sharma, Ms. Preeti Sudan, Dr. Anupa Sidhu, Dr. Soumya Hegde. Before we commence our program, let me take you through a short journey of IWFA and how it can work for you. The All India Women's Education Fund Association is the body of Lady Irwin College. Founded in 1929, the first president of IWFA was Lady Dorothy Irwin, and in 1932, the college was established to empower women through education. The IWFA office is within the campus of the college, and it is housed in the first director, Ms. Hannah Sen's residence. Who is IWFA? IWFA is an NGO. It elects the governing body of the college. It conducts programs for sustainable development and empowerment of communities, women, and children, and it administers the annual IWFA Nina Sipal Award. UN affiliations commenced in 1999 when it got the ECOSOC status. In 2003, it was appointed regional coordinator of the UN's informal regional network of NGOs. And in 2017, observer status was granted to IWFA from the UNFCCC. We partner with a lot of stakeholders from the government, corporate NGOs, bilateral agencies, private sector, and NGOs, etc. So we have a long list of stakeholders whom we get into our programs and a lot of CSR collaborations, as you can see from this slide. What can IWFA offer you? IWFA's Youth Brigade are eligible to get a certificate if elected for a program as a volunteer or intern. And IWFA work environment to the interns as they study is provided. You can reserve your space in skill development initiatives held from time to time. Volunteers for upkeep of social media platforms, report writing and designing, administration, etc. are available. So you get a work experience while you are studying. Scholastic pathways are available in the IT and social media campaigns and toolkits, website and report content writing, designing campaign posters and other advertising material, technical resources for webinars, conferences, seminars, workshops, as well as in the administration. Should I mute myself? Is it okay if I continue?
Yes, ma'am.
Yeah. We have a whole lot of skill development initiatives that have been conducted in the past. These include 400 underprivileged women who were taught car driving under the aegis of the Maruti Suzuki India Limited. 150 women were trained in self-defense by Delhi police. 5,000 diverse college students attended cybersecurity workshops, prevention of drug abuse, and intergenerational workshops. We have an ongoing 1-month professional diploma in banking for final year students and graduate students. Conference and seminars have been held with UNESCO, with UN Women, with CII, and a whole lot of other organizations. And since the COVID-19, we've conducted a lot of webinars. As you can see, this is the second COVID-19 series. The first was on disabilities. Webinars in the time of COVID-19, a series of 5 with support from the National Institute of Social Defense. And this was the first webinar series, Sustainable Solutions for Persons with Disabilities, which was held in June and July 2020. The IWAFA Nina Sibal Memorial Award was first held in 2003, and it carries a citation, a trophy, and an 8 lakh rupee check. Permanent venue is the India Habitat Center, but due to the COVID, we had to hold it virtually last year. We hope this year it will be a physical program again. Lots of UN programs. These include campaigns like A World We Women Want, Khadi Goes Global, all affiliated to the Sustainable Development Goals and the 2030 Agenda for Development. An upcoming program, a virtual webinar, A World We Women Want, Gender Just and Violence Free. It is being held on the 18th of March 2021 with a permanent mission of India, New York, and we look forward to everybody participating and supporting in various programs that will lead up to this webinar. For corporates, we invite collaborations, as IWAFA has got the ATG certificate, it has the 12A form, it has an FCRA account, and it has the Niti Aayog registration with the Darpan site. Some past projects, webinars, workshops for youth, elders, colleges, women, underprivileged people. There you have the IT Minister, Mr. Prasad, who inaugurated our cybersecurity workshops. And Meenakshi Lekhi, our MLA, in the Swachh campaign, rural programs, legal awareness programs, skill development initiatives in rural areas. Now, this is a world we want to see happy, skilled, gender just, violence free. Well-being of people is a very important issue. And of course, digital is part and parcel of life now, especially after the COVID-19. So take a stroll to the IWAFA office for a chat and speak to the office secretary and coordinator. Share your name, phone number, and email your area of interest, copies of any work you may have done. And donors, welcome. Drop an email and we'll connect with you. If you can drop the email at iwafa29@gmail.com. Students and volunteers, do come and help and support. We look forward to your support. Thank you, and help us all, help you, and help society. Thank you.
Thank you very much, Asha, for detailing the very diverse activities of IWAFA, all the work we've done, and our look ahead for the future, hoping that more and more young people join us in our mission to help the society and to enable social justice for all. I now request Dr. Virendra Mishra from the Director, National Institute of Social Defense, to join us to give us the contextual preface and the understanding of the NISD on this very key subject. Dr. Virendra Mishra is a celebrated Indian Police Service officer, and in his career spanning over 2 decades, has been working to make the society sensitive to its surroundings. He currently heads the National Institute of Social Defense, which has taken up the cause of drug use prevention, the welfare of senior citizens and transgenders, and beggary prevention. As a secretary of the Adoption Resource Authority, he worked towards making the atmosphere conducive to child adoption and promoted inter-country adoption of children from India. He has also made a short film highlighting the plight of the BDR community, where prostitution is a curse and accepted norm in families. Dr. Mishra has authored a number of books, served in 2 UN missions, and has a pro bono involvement in many other missions. He has represented India in many conferences and workshops in the BRICS, SAARC, regional workshops and formations, ISAP and UNODC in Vienna, among many others. Dr. Mishra, we are looking forward to hearing your views about the subject at hand, the issue of health and nutrition for the elderly. And we once again thank you for having supported our webinars, the 4th in the series and 5th one to come. Dr. Mishra.
Ma'am, I think Dr. Mishra has just logged off due to some connectivity issues. So maybe we can move on to the next speaker.
All right. We will get back Dr. Mishra in the course of the evening. And I would now request Dr. Preeti Sudan, our very celebrated first speaker, specialist speaker. Dr. Preeti Sudan is a colleague of mine from the civil service, the Indian Administrative Service of the 83 batch from the Andhra Pradesh cadre. She retired as Secretary, Ministry of Health and Family Welfare, Government of India. Prior to this posting, she has also headed as Secretary the Departments of Food and Public Distribution, Ministry of Consumer Affairs, and Public Distribution. She's also served as Special Secretary, Ministry of Women and Child Development, and as Joint Secretary in the Ministry of Defense. In her very varied career, and her very distinguished one, her notable contributions to policy have been initiating and implementing 2 major flagship programs of the country, initiated by this government: the Beti Bachao, Beti Padhao Andolan, addressing child sex ratio through life cycle empowerment of women; the Ayushman Bharat, the very significant and the world's largest government-funded universal health coverage scheme. She was the chair for the Partnership for Maternal, Newborn and Child Health for nearly 3 years. She was the former chair of a legislation on National Medical Commission. She has served as a consultant in the World Bank in Washington. She's also served as the vice chair of Partnership for Maternal, Newborn and Child Health, former chair of Global Digital Health Blueprint. Preeti, in her distinguished career, is now a member of the Independent Panel for Pandemic Preparedness and Response set up by the World Health Organization. I believe IWAFA could not get a better speaker to give us a perspective of the subject at hand and the current policy towards meeting the pandemic for ensuring health and nutrition for the elderly. Preeti, the stage is all yours.
Thank you so much. Thank you for inviting me, and so good to see you, ma'am, and my friends. Anupa is here and others also. Sorry,
Glad to see you.
I had a technical challenge. I'm using my daughter's laptop, so I'm been instead of Preeti Sudan, but doesn't matter. We are carrying forward the generation. My topic is basically on health and nutrition. And I'm 60 plus, so I am an elderly. I have a presentation made for this lecture, which Ms. Asha Chandra suggested that I send it to you so that you can please put it on the chat, so that if somebody likes to follow that as I speak, that will be a good idea. Thank you. Now, when we look at the world scenario, you see, even with the COVID, we've got vaccines within a year of the pandemic. It's not a small achievement. So the that we have in the world and in India also, life expectancy increased, the fertility rates have decreased, and so gradually the number of older people is actually increasing all over the world. And if you see the world scenario, Japan has 28% elderly, that would be above 60. Italy has 23% in the older age bracket. And if we see India, we of course are still demographically young, but we are rapidly going there. So in 1950, when we had just 5.3% of the population as elderly, in 2020, it's estimated to be 10%. And by 2050, we will be 2050, Indians will be above 60 years. So I am highlighting this because I feel that this is extremely something that and then as government for implementation in departments, ministries, states, and at the local level, we need to actually strengthen our required interventions. And then as a society, we need to make the ecosystem conducive to the elderly. So this is a very timely seminar. Now, if we try to categorize what are the challenges faced by the aging population, I would say that they are basically, you can categorize them into 4 categories. Physical, disease, communicable, NCD, then, frequent falls, and then lack of mobility. Psychological, increased forgetfulness, depression, to name just 2 of them. Then social, you see the social circle becomes narrow, isolation, neglect, and sometimes, unfortunately, older abuse also takes place. Then economic, because they are not actively involved in economic activity, so there is lack of continuous income. And on the other hand, there is increase in health expenses. So therefore, this being the basic challenges, let me concentrate today on today's topic on health-related and nutrition issues. We have in India from the Ministry of Health and Family Welfare, which is the longitudinal aging through the International Institute of Population Sciences in Mumbai. Now, these studies have been conducted actually in Korea and Japan, but in India, this is the first time. So what is it? See, this study will be over 25 years. So every 3 years, actually, there will be, you see, findings that will be published. Wave 1 has been published recently. And this is this study is important also in terms of, the sample size. So 72,250 odd 45 and above aged people are involved, along with their spouses. About 60 plus, then 6,749 above 75 is that with comprehensive biomarkers, the health biomarkers, then the family social networks, income, assets, consumption. This study is going to look at our aging population. It's very important in terms of policy, as I also. So this study finds 75% of elderly suffer from one or other chronic disease, 40% from one or other disability, 20% issues of mental health, depression, loneliness, and forgetfulness. So these are the issues that they suffer from. Apart from that, they what is called geriatric syndromes. Syndrome. People, then very likely to have dementia, very likely to face polypharmacy. That means more than 5 medicines they would be taking. Then they may suffer from, reluctance to eat because and of course, I said earlier, elder abuse. So these are categorized technically as geriatric syndromes. And the Lassie study found that malnutrition in the elderly is huge. Malnutrition, of course, can be both obesity and underweight. Most of our elderly are not, they are more underweight than obese are. So this BMI, we found that 32% are either underweight or obese, but more on the underweight side. 16% are malnourished. 67% are at risk of malnourishment, and only 17% are actually well nourished. And women, because of socio-economic reasons, which I'm sure IFI knows and must have highlighted in their many seminars. So you see, it becomes a circle. It becomes a circle of not being able to eat, then having weight loss, having low energy, muscle wasting, increased risk of fractures, increased risk of hospitalizations, then infections, and of course, reduced independence. So this is a whole cycle. You see, you have reduced mobility, you have increased falls and low mood. So all this actually gets into a vicious circle. What can we do? What as families we can do? What as a society we can do? And what as government we can ensure? How to make the life of our elderly better? So some of the tips that we gather from literature and from experts are that home cooked and freshly prepared food is the best, because there's lots of taste also as far as they are concerned. Since protein deficiency sets in, so nutritious food with high protein content, and then taste and smell intensification of food and better visual presentation of food so that they feel like eating. And then eating in a communal setting. You see, eating alone is not very it's not very welcome. So if they're sitting with the family or they are sitting together amongst friends, maybe they'll eat better. And small frequent meals, because you see the digestion system also takes a beating. So small frequent meals are easier to digest. Then of course, high fiber diet. So salads are very important, and very, very important is again adequate fluid intake, water. I am, my 93-year-old father lives with me, and I can vouch from personal experience that all this, what I'm saying is also from experience, and of course from what I learned from the experts. And some do's then, how do we cope with this situation? It's important that, a visit to the doctor is done regularly, at least 6 months, if everything is going well. And of course, there should be a multidisciplinary assessment and intervention of a dietitian, psychologist, physiotherapist, social worker. So it has to be a package. And of course, and substance abuse is a big no-no, because it can lead to other complications. So that also is required. And then oral health is again, you have falling teeth, and then you have your gums are getting loose, and maintaining proper oral health is again a very, very important, and that also affects your food intake. And of course, one should avoid counter medications and supplements because and not go on advertisements at all, because they can be very harmful. And very important is also to engage in some kind of a physical activity. You must have, I'm sure you know of the Fit India movement. So there were protocols which were made, age-wise protocols on what exercises and what, how yoga could help different people, different age. Age-wise protocols were also made by Ministry of Health. And I would urge you, they are available on the internet. Please have a look at the fitness protocols and the yoga protocols for the elderly. They are really important, and things like engage in physical activity for 30 minutes. Just stretch yourself, and laugh out loud. Take a dose of sunlight, and these kind of things which are doable age-wise. So that would be important. And Vrinder, I'm sure will speak on it, but since he hasn't spoken, so I'd like to mention also that the Ministry of Social Justice and Empowerment did come up with a very important document, National Policy on Older Persons, in 1999. And it was a very well thought of document. As a consequence to that, the Ministry of Health also came up with national program for healthcare of elderly. And if you look at the components, it is again a comprehensive document of dedicated care services. It has an architecture for aging, a framework, and convergence with all the existing programs. The most important thing is the implementation. Now, I'll very briefly, because this is a varied conference, varied participants are here. I just want to say that, you see, it's important, and I have seen from personal experience when I was actually designing, implementing Ayushman Bharat, that if the help is nearby, which means if the help is near the residents, then the accessibility actually prompts people to visit. If we have to travel, then you see people keep postponing their small issues, which can then become catastrophic. So thoughtfully, you see this health and wellness centers, which are one pillar of Ayushman Bharat. They have geriatric care as one of the 12 services to be given. I have always felt that the primary healthcare in India is gender sensitive, in the sense that we have taken care of maternal and child care services. Of course, not women's health on a life cycle basis, which we are doing now. But apart from that, now additional packages in the primary healthcare are being added, and it's great pride that I say that already about 60,000 these sub-centers and PHCs have become health and wellness centers, and people are going. And there is this NCD screening also for oral cancer, breast cancer, cervical cancer, for diabetes, for BP, because blood pressure, and these are the kind of non-communicable diseases which have become very, very important, in the sense that if they're diagnosed early, then there's a cure. Otherwise, and end in extremely catastrophic incidents, which can actually also economically affect our elderly population. And when I went, this is from personal experience, to some of the villages to see, it was very heartening to see old women come for checking their BP, to check their blood sugar. And again, accessibility made the difference. So I'd like to emphasize that it is accessibility of these services that's very important. I know my time is going, I have limited time, so I'll just sort of skim through the others. Please have a look at the presentation that I have given. So as I'm saying, that it is, you see, at the district level, at the sub-district level, that strengthening of these geriatric services is envisaged, and it has happened in few states. As I said, implementation is a challenge. Training is very important because geriatric services, again, you see, need I would say sensitive and also people who know how to deal with elderly. So there are protocols for training also, and there are centers of excellence in the new AIIMS that we are having, geriatric wards, and then the are being constructed where you see the requirement of a geriatric patient. The bed should be low or the bed should be high, or there should be when they visit the bathroom there should be some support to hold. So all those things are being looked into, not only in construction but also in the delivery of services. There are also national centers for aging that are being created, and also national institutes of geriatric care. Two are envisaged. One is coming up in Chennai and the other in AIIMS Delhi. So if you have a chance, do take a look at it. So these are the government interventions. But what I would like to again emphasize is that in families and in society, we need to be more sensitive and also ensure that we always, as a society, I think India is great in the sense that we respect our elderly, we value our elderly, so that has to continue. And again, I'd like to say that even during COVID, it was seen that families have protected their elderly. Though the death rate was higher in the elderly, but the infection rate was lower in the elderly. It was 40 between 40 to 50 that the highest number of COVID cases was the last I knew. I haven't seen the latest statistics yet. So this is from my side. Basically, I'd like to say that a multi-pronged approach is required, and we have to all work together, government, society, the NGOs, and also I see a lot of press people here. So I'd like to say that you must highlight all the issues because you are our ambassadors to carry the messages far and wide. You must also, raise and highlight the issues of the elderly. So thank you for having me. Thanks.
Thank you, Preeti. I'm grateful to Ms. Sudan pertaining to policy. I'd like to know about her recounting of initiatives for the rural women and the intervention upwards to the and one of the most heartening features of education. Forward to the thank you once.
Rita, Soumya, Dr. Soumya will go next. Yeah, she's having some trouble in her audio trouble. So Dr. Soumya will.
Friends, we are privileged to have Dr. Soumya, geriatric psychiatrist, who is going to share her views on strengthening mental well-being. Friends, Soumya has 2 decades of experience trained in India and the United Kingdom. Holistic approach, which includes medication, supported psychotherapy, individualized care plans, and care training. She has played an active role in awareness and advocacy campaigns. She is also conducting programs caregiver. She believed that of mental illnesses can significantly improve quality of life amongst the elderly and this is really great. Share your
Thank you, Rita, for that very expansive introduction. I'm humbled, and I really enjoyed my previous speaker, Mrs. Preeti Sudan. She spoke so beautifully and so well. I really enjoyed listening to everything, all the initiatives taken by the government. I think for us clinicians, it's very nice to hear about what's happening at the higher levels in terms of policy development, because we don't play a big role in those areas, but it's very nice to see that the work that we do in a small way is actually being generalized across the country. So it was lovely hearing you. I'd like to share my slides. Mayanka, can I go ahead and share the slides? So you're able to visualize what I want to talk about. Okay, I'm going to try. Let's see if it works. Yeah. Can you all see the slides?
Yes.
Okay. So that's me. I'm a geriatric psychiatrist. I practice in Bangalore. I have been quite actively involved in managing patients with dementia in residential care facilities as well. For most of my time in India, I think for close to 7 to 8 years, I was working with one of the NGOs, managing one of the largest residential care facilities for dementia in the country. So a lot of my experience comes from managing elders with real challenges with mentally illness. So before I go into the body of my presentation, I think I like to define age differently. And I don't like to equate it to the number of candles that we blow on the cake every year. So I think for each of us, age is something different, and we need to understand that age is not really the number of years that we've lived on this planet. Our age is how we think of ourselves and how old we want to be. So that's the psychological age as opposed to the chronological age, which is the number of years we've actually lived. Okay. As Mrs. Rita Prasud has also said, that there are lots of challenges that we have, the elders face in the world today, and particularly in India, with the fragmentation of the joint family system, we're moving into nuclear families. So a lot of elders are forced to live alone, live a life with lack of dignity, lots of health issues, which she has elaborated in her talk, physical abuse, crime. They also face emotional challenges like loneliness and depression. And also the financial and economic challenges that elders face have been mentioned previously. So my focus today is, I've tried to focus on mental illnesses in the elderly as the topic for today. And moving on to one of the commonest mental illnesses that we see is depression in the elderly. And the reason I picked this is because I often think of this as the elephant in the room. It often goes unnoticed, undiagnosed, and untreated. And it is so important to recognize the condition, which is why I thought that I will spend some time in creating a bit of awareness about the symptoms of depression. So if you see someone who's elderly and is genuinely depressed, then they need to be evaluated, assessed, and treated. Okay, so the features of depression, more or less the same as we would see in a younger population. So the mood has to be sustained low, as in they must feel that I feel low in mood, and that has to be sustained for a considerable duration of time, for at least 2 weeks. So someone who says that I'm having a bad day, I feel a bit down today, doesn't necessarily mean that they're depressed. But if that feeling is sustained over 2 weeks, then yes, you need to evaluate it further. There's also a decreased interest or pleasure in activities that they previously enjoyed and looked forward to. Even if it means watching soaps on television, a lot of elderly people, elderly women particularly, enjoy doing that. And all of a sudden, if they show no interest, they don't care whether the time for their serial has passed, they're not interested in cooking something new when the grandchildren visit. These are all indicators that something's not. Along with this, we may also see sleep disturbances. Either they wake up very early in the morning, 3 o'clock, find it hard to go back to sleep, or find them sleeping all the time during the day, not taking part in activities they previously did. Feeling very guilty that they probably imagine themselves to be a burden on their children, that, I have physical issues, my child has to keep taking me to hospital. What is this life if I'm such a burden on my kids? These kind of thoughts start to plague their minds. Loss of energy, feeling fatigued all the time, problems with concentration, unable to read a book or newspaper, keep picking up the same book over and over again because they can't recall what they read the last time, disturbances in appetite, and even sometimes suicidal ideation and thoughts of death. Now, this is something we need to check. And there is, it's a misconception that people, if you ask them if you feel like life isn't worth living or you feel like ending your life, it might actually give them the ideas that they could end their life. That's not true. And it is very important to check for this because elderly suicide is a huge issue. And unlike young people who might harm themselves as a cry for help, elderly who try to attempt to harm themselves actually end up killing themselves. So they don't take multiple attempts. So we need to pick this up pretty early. Okay, so coming to the causative factors, again, you've got biological factors. As I said, a lot of physical illnesses can also coexist. Depression can coexist with a lot of physical illnesses like Parkinson's, diabetes, vascular disease, stroke, chronic pain of arthritis, back issues, kidney issues. So a lot of these can also cause depression. Social issues like isolation and loneliness, and psychological factors like, what's happening to me? Why am I not looking the same as I was? I don't want to step out because I no longer can walk independently. I don't want people to see me with a walking stick. I don't like the way I look anymore. So a lot of these psychological issues start taking a toll on the individual. So how is depression in the elderly different from a younger population? One, they don't talk about it. There isn't many people who come and ask them about it. They're not going to work. There are no workplace colleagues. So it requires a lot of persistence on our part to check and ask. They try to deny their depressed mood. And very often we also, assume that it's a part and parcel of older age. It's okay if he's not doing anything. I mean, he's getting older. What more can he do? It's all right if he's not doing a lot of things he did previously. So there's this assumption within the society also that it's okay if number of activities drop as persons are getting older. That's just natural. So that is not natural. They're preoccupied with a lot of somatic symptoms, constantly complaining of backache, headache, burning sensations. So these are all triggers, and especially when all medical factors have been ruled out, then we have to go down the route of, is this depression, and get it treated. There's also a lot of anxiety and agitation as elderly people are depressed, and a lot of medical conditions can mask the depression. So you become so preoccupied with taking care of their physical health problems, maybe their high blood sugar or high diabetes, or hypertension, that you ignore what are the other things that this person used to do and is no longer doing. Treatment options, very similar to a younger population, and all of them work for an older population too. So counseling and therapy, particularly helpful in the mild to moderate stages of depression. It might take longer for them to respond, but they will respond. And if they respond, then the relapse rates are less as in compared to the younger population. Medication works just as well. In fact, works very well for an older population too. So if required, we need to treat them with medication. And then not just a single line about ECT, because it is again another treatment form, which is often, there's lots of myths around it. But for an elderly population with multiple physical illnesses who already have so many medication going on, and do not respond to the medication, ECT works wonders. And it's done very, very systematically now. It's not like how the movies projected ECT in the past. So it does work for an elderly population. Okay. Now, the next thing that I wanted to talk about briefly is anxiety disorders, particularly in the elderly population. And I thought that would tie into some of the issues we've been having with the COVID situation right now. What is anxiety? We all experience anxiety. I was feeling a bit anxious before starting this talk today. I was feeling a bit sweaty and nervous. I don't know whether I'll be able to, whether my slides will come on or not. Will I say the right thing? So we all have this feeling of a bit of butterflies in our stomach from time to time, before a job interview, before an exam, before getting married, may last a little longer, for a month maybe. So it's a normal adaptive emotion. Anxiety is normal for a lot of us. And it's important we understand what is normal before we understand what is pathological anxiety. But when it is excessive, as in I am so preoccupied with this negative thought all the time, I'm so afraid that I'm not able to focus on any of my day-to-day activities, then it becomes pathological and needs to be addressed. And it is extremely common in the community. Nearly 10 to 11% of people in the community with mental illnesses or without suffer from anxiety. Said, constantly preoccupied with this worry. During the pandemic, we had a lot of elderly people who were so afraid that all they could think of is, I will get the virus, I will catch this. If I have COVID, I will land up in an isolation ward. My family will not be able to see me. I will die, no family around. I cannot, this thought was so consuming that they actually became pathologically anxious and depressed. So very scared of what's going to happen next. And it is exhibited in the form of restlessness, uneasiness, difficulties in sleep, not eating, not able to do anything in the house. And heart palpitations and hyperventilation could be some of the features of a panic attack associated with anxiety. So it becomes very visible to the outside as well. What are the interventions when people are anxious? Now, this is apart from the COVID situation. It's very important for us to structure their day. So we tell them that this is the task you need to do from this time to this time. If I wake up in the morning and I don't know what my whole day is going to be about, I am going to feel anxious because it's just a blank. I don't know how to occupy my mind or my time. So giving people a structure to the day, even especially as we get older, is so important. Each of us wakes up in the morning knowing that this is something I have to do today. I have a purpose for my life. I have a purpose for my day. What if I get up in the morning and I have no children to get ready for school, no meals to be packed, no patients waiting for me in the clinic, no husband interested in understanding what I've had, what kind of a day I've had today. There's nothing happening. My day is a blank. That does cause a lot of anxiety. So having a structure to the day helps considerably in reducing this. Exercises help. Instead of pacing up and down, give them some form of physical exercise which they can do, simple exercises which they can do, and a repeated action helps. Particularly activities like knitting, doing the mandala art, the adult coloring books. These are all repetitive activities which allow the person to focus and reduce anxiety. It also, as said by my previous speaker, regular appointments with the doctor certainly helps, because instead of having these thoughts and going through them in their own heads, at least they'll be able to speak to a professional who understands and can give them an explanation. So during the pandemic, we certainly saw a big increase in mental health problems. And thankfully, we were able to offer a lot of help and support online. And also, thankfully, almost all of our senior citizens at least had access to a mobile phone with WhatsApp. So we could, connect to them over WhatsApp videos. So what was the reason for this increase in mental health issues during the pandemic? One was that they were predisposed. Yes, that is the truth. They were predisposed to the virus because of their health, because of their, comorbidities. A lot of them were diabetic, hypertensive, as I said, had other chronic diseases, so they were more susceptible. They were also more socially isolated. As it is, the elderly population is isolated. Because of the lockdown, they were further isolated, which made the situation only worse. They didn't have access to a lot of the medication and healthcare facilities which they had previously. I remember, when Preeti Sudan was talking about rural healthcare. I remember when we were doing a rural internship, every 2 weeks, we would have busloads of elderly women coming for their weekly shot of injections, the multivitamin injections. And while they would wait for the nurse or doctor to administer the injections, they would all be sitting and talking. It was a good socializing activity. They would come by bus and then they would go back to their villages by bus. That in itself was a social activity. Yes, it was driven by a purpose of getting that injection, but the whole process, which took about 4 to 5 hours, was socializing. So it really helped. And I think they missed out on all these little things during the lockdown. The constant stream of media information also led to a lot of anxiety. Every WhatsApp message, every television channel, the radios, everybody was only talking about how the elderly are more susceptible, how the elderly should take extra precautions, how they should stay indoors, which didn't help the situation at all. What were the interventions that we put in place during the pandemic? One is we wanted to use print and media as a teaching tool. So we actively tried to create messages which were more positive. So the elderly did not have to look at a lot of the negative messages. We told them to switch their televisions off and only watch maybe documentary channels or Animal Planet or things like that, which did not talk about the news and what was currently happening and how many elderly were being affected by the virus worldwide. We also asked local youth and volunteers to help, to make frequent calls to the elderly people who were living alone, just to see if they were okay, if everything was fine, they got their groceries, they had their medication. Just a call really helped. And knowing that I can expect this person to call me every 3 days gave them something to look forward to, knowing that I'm not all alone while this is happening. Video calls with family and friends. A lot of volunteers went over and taught elderly people how to use the video call connected with your family. Online programs like online CBT was something that was initiated. Very interestingly, this is something I'd like to share. We've had this pandemic now since March last year. We're coming to almost 10 months of the pandemic. And during this time, a lot of research has been done to understand what has been the outcome of this, and psychological and physical outcome of this in an elderly population. And the truth is, most of the research is now indicating that older adults were actually less negatively affected than a younger population. And that is extremely heartening to hear. And that's what I see. Recently, I had this patient who told me that, doctor, why do you even think that elderly people are more at risk? We are the ones who walked 6 miles to get to school. We are the ones who never ate fridge food or frozen foods or processed foods. We always ate healthy. We led very disciplined lives. What makes you think that we are more at risk or we are not going to be able to fight it as much as a younger person? And that is the truth. And that's what research is now showing, that elderly people have actually showed a lot of resilience and they have been able to fight it. Particularly in India, and I'm really, really pleased to say this, that I think our Indian elders have shown a lot more resilience, and we should appreciate, whatever structure we have in our society to have been able to enable that. The role of wisdom is another factor that comes in. Elderly people have seen a lot of challenges in their lives. They have, some of them have seen the world wars, some of them have seen the wars within India, they have seen poverty, they've seen a lot of very difficult times, and they've lived through it. They've learned how to live through it. This kind of pandemic situation has probably, younger people have been exposed to it for the first time. There are a lot of things that they used to are not available to them. But for our seniors, this is not something that has happened for the first time in their life. Maybe the virus is, but in terms of not having a lot of things or access to a lot of things, they have been through this before. So that wisdom keeps them going. That wisdom has helped them overcome a lot of the issues that a lot of younger people have faced. Do I have time, Mayanka? Others, I won't dwell onto this too much because I need another 5 minutes.
Yeah, we are running a little late, so maybe we can do.
Yeah, so then I wanted to talk about dementia, but of course, I think a lot of people know what is dementia. It's cognitive impairment, more than what is expected. But I'll just quickly talk about how can you delay cognitive impairment. As you can see here, the belief is that only 1/3 of conditions like dementia cause genes that we have. More than 1/3 is because of our lifestyle choices. So there's a lot that we can do as we grow older to minimize our chances of developing cognitive impairment. Physical activities, particularly aerobic exercises, strength and endurance training, balance activities help, not just walking in the park. Walking in the park every day in the same park, in the same route, meeting the same set of people is not exercising our brain. It is exercising our heart and maybe our muscles, but not our brain. So we need to diversify the kind of exercises that we do. Cognitive activities, we're all very aware of a lot of brain games, doing something different, even if it means writing with your left hand, doing your hair with your left hand. All these are doing the same thing slightly differently. Pick up a new hobby is something else that I have to talk about. Learning a new language is extremely beneficial to our brain. Getting enough sleep, and if you're not, addressing that issue, and eating at least one meal with family and friends rather than eating on your own. So if we look at the risk reduction in terms of developing these conditions in the future, you can see 49% risk reduction by keeping engaged socially. So, gossiping, meeting up friends, which has all taken a toll during the pandemic, is supposed to be the most beneficial for our brain. And even if you can, virtually connect with people, hear new ideas, it is actually benefiting your brain. Even if you're absorbing only 10% of it, your brain is benefited. So it's worthwhile doing that. With this, I'd like to end my talk and thank you very much for this opportunity, IWIFA. I'm really grateful to have been given this platform to talk about these issues. My sincere thanks to you all.
Thank you for joining us. And here of experience in the field, and you
thank you.
Again, a very one. And head of the Department of Home Science in the University of Delhi. Dr. Sidhu is going to present views on strengthening capacities of elders and personal plan. She completed her graduate She was awarded the gold medal in 1988. A very celebrated professional, she has been conferred with various awards, namely the Shikshak Ratna, award, member of several research and professional bodies of national and international repute, ministries in food safety, nutrition, and nutritional security. Dr. Sidhu is the go-to person for Government of India for any lab testing of ideas. And Dr. Sidhu, I'm listening to share your views on strengthening capacities of and personal plan. Dr. Sidhu.
Thank you so much, Rita ji, for inviting me to share my views in the webinar. And old age comes very naturally to my research thought processes, because I think when I started doing research in my master's, this was the topic I chose. And most of the people at that time, they just said there is problem of malnutrition or undernutrition. Why are you always interested in obesity and elderly? A little offbeat in that sense. But I had procured a new skin fold caliper, and therefore I felt I would put it to use and make new standards, because it was such a neglected group. And with such paucity of data in India that we had, except census, there was nothing pretty much available in terms of standards, etc. in the 70s. And so I embarked on this journey, and at every little point I work again. If I'm working on energy expenditure, I come back to elderly. How does it change with age? How does BMI change with age? How does body composition change with age? So these are my usual questions. But specifically in today's context, I mean, we have come, at least I see myself as coming here a long way. At that time, study circle member of Age Care India, and having certain sessions at India International Center or with Dr. MMS Sabharwal in HelpAge. These were my forums in the beginning. I feel from discourses that were held then and to what is being talked or not talked now, there are many similarities, and therefore I want to draw upon this. That somewhere we will have to look at it very carefully, because all parts, we are a very heterogeneous country with a lot of plurality. There are rural issues, urban issues, and therefore we need to look at the capacities of the elderly and what do they want, what is their understanding, and what is their personal plan. The best part is Dr. Preeti Sudhan has talked so beautifully about nutrition and the daily guidelines, dietary guidelines. and the general health guidelines and specific state guidelines for elderly. So most of it does get covered in a very large canvas. And yes, the social and the walkability things are also talked previously by the previous speaker, Soumya. And so that, really stages what I'm about to say. And I will say rather briefly, by flagging these issues and on the canvas, just have a map as to where are we, where are the people, and what are their aspirations. So just do a little networking without making a very complex chart. So next slide. So yes, we all know that the UN is saying, HelpAge is saying that the numbers are growing, and from 1961 figure of 5.6, it's worked out to 8.6. But the population, our population is very large. So even this 3% increase is a huge increase in the number. And in 2011, it was 104 million people, elderly in India. 7.7% were male and 8.4% were females. And by and large, there is a contribution of advancement of medical sciences in general and raising life expectancy from 67.5 years. And in the next 3 decades, it will come up to 75.9. But during the earlier times also in 70s, we found people of 90 in the age group of 90s, even now the age group of 90s. But I find the quality of life of generally 80 plus is reasonably good. And so it's not just a question of raising the life expectancy, we want to see the quality of life. Next. Generally, we put it in a classification that senior citizens are 60 plus, but there are many more classifications as young, old, and old, and there are many more ways of looking at it. But 60 plus, we want to generally look at them, look at their understanding. It coincides with retirement. Sometimes these retirement ages change, but there is a major transition, and I think it requires a level of preparedness. Care of elderly is more neglected area, and it requires strengthening. There are many master NGOs that are working in this area for many years, and a lot of initiatives good initiatives have been taken. And there are some more state initiatives, as I said. Even medical colleges have opened a department of geriatrics. I remember in early 80s also, such departments were not there, and there were by and large in Department of Medicine or something, there would be one study group or one unit who's working on old age or geriatric or fall. So, however, health and well-being in late life needs to be much better, needs much better attention, and with growing number of older people, the visible impact is seen on their financial, their social protection, family structures, and complex health-related issues. The existing health system still does not commensurate with the felt need. So yes, they are all there, but there is an issue of implementation as highlighted by Preeti Sudanji, and that is true of most programs in the world. Specifically, we have this problem in India due to large numbers. And correct planning of who's going to implement, when, where, how. So I think those program implementation really requires a very deep rethink in most things, but especially elderly. Next. As already has been said, these are the usual issues: fall, frail, dementia. Frailty is when the muscle is, not supporting a lot of things, and I hope it's, it makes certain things very, very difficult, and it requires, there is a lot of work which is coming up, but it requires much more work. And multimorbidity. Dementia and loneliness are the issues which are not very easy to address. But yes, there is an immediate remedial, and there is recuperation also. So, but they are not easy. So they are more complex. There are issues like Alzheimer's, and you have all these coconut oil diets and all N3 fatty acid diet, fish oil diet, fish oil supplementation. So, when it comes to nutrition, health, and daily coping, we have all these kind of things. But yes, what works is a social structure, that has been said just now. So active aging is a term to reckon with, and in many developed countries, preparation of active aging is not a priority still in the country. It's not a felt need by the elderly. They, kind of succumb to it. It's taken for granted when they're looking at each other. So they are always saying, I am better than that one, and it's not a problem. In this age, only this can happen. So, there is an element of not flagging certain things which are pretty doable. And aging can be a demographic dividend, but due to non-preparedness and the dependency ratio increases. So our senior citizens should be active till late life. This needs to be discussed in our country. Many people in many Western societies, 90+ people actually catch a bus. Those professional professors, they go up to the universities, sit there, follow a good routine. They almost are on negligible beverages, negligible amount of food, just enough to need. So there is I think we should look at these positive deviances, what works, and what leads to healthy senescence, and to reach a good age, and without compromising substantially to quality of life. So I think this is something which we really need to inculcate in the society, by which I mean to say, have a capacity building. Yeah, next. So in a World Aging Report by UN, 65+ is expected to be more than child of 5+ at the end of 2019. In India, geriatric healthcare is changing, and national programs of healthcare of India, which I think Preeti Sudanji just talked about, I think covers this. So there is a good understanding in planning, and the objective is to provide easy access to promotional, preventive, curative, rehabilitative services to the elderly through community-based primary health care approach of capacity building of the medical and paramedical professional also, and also the caregivers within the family. So these are the tripod. I mean, these are operating at 3 levels on a daily basis. They should gel seamlessly. It should not be jerky. And that suddenly the elderly looks at it as suddenly, which has come up, that the person realizes the gaps. So it should be seamless. And just as an example said, that some of them, they just walk up to the local place, local health center in a rural and they are meeting doctors, nursing, generally spending time. The paramedical staff sometimes gets upset and says, she's perpetually asking medicines. He's perpetually saying some medicine is needed, I'm not well, when the person is perfectly well, and you give a placebo of multivitamins. So whatever may be the issue, the fact is that the care should look seamless, and the person should be encouraged to move around and not, kind of whisked off and discouraged for health-seeking behavior independently. So next. I'll just flag this. This has been stated right now that there has to be a capacity building by the state, access to affordable quality healthcare system. So we have these mohalla clinics, and they should come to better action. Many of them are doing extremely well, and there should be trained medical and paramedical professionals. So not all people sitting in these local health centers are on same page. They do not understand how one would have to deal with an elderly, what will be their usual questions. So I think there should be this kind of SOPs that, if it is a person of this age, these are the things you should definitely look for, encourage them to visit again, be looked after. So there needs to be certain orientation of the medical and paramedical staff, because in a general health clinic, people of all age groups will come, and you can't have a special geriatric care, because then even the geriatric will not specially come. So let it be inclusive, but there should be a little bit, a better orientation of the staff so that they are able to talk to them and deal with their day-to-day. And even if you don't feel that there are frank problems, you generally engage with them to and increase their capacities to look for themselves and maintain diaries, records, peg their health points. Now bring your blood sugar to this, do abide with the diet, abide with the guidelines. So things like that, or a daily monitoring of blood sugar or blood pressure. So I think those are certain things that the training of the staff is very important in both rural, urban, and wherever. To be amenable to all age groups and all life cycle requirements. Provide health navigators and monitoring systems and the emergency care. So if there's an elderly who says, I am in trouble, so अभी तो उनको यही मालूम है कि 100 नंबर को डायल कर सकते हैं या कोई एम्बुलेंस को डायल कर सकते हैं, लेकिन कोई और भी navigators and monitoring systems develop किए जा सकते हैं. So most have must have systems approach. And I was today listening to somebody from Michigan State University who's basically working on an artificial intelligence and system. So you peg those points and look at the trajectory, and then you understand the variables. So you cull out those 3 critical points which will make a difference and will lead to 99% success of the goal you peg. So I think we need very systematic steps and just 3 doables to reach the goal. So it's not likely to be very complicated, because sometimes that can be very intimidating. So I think we should do a certain amount of strategic modeling, and that I think should be done by state, and we put the systems in right and have a systems approach, and in such a way that the person is able to have a personal plan. उसको डायबिटीज है, दूसरे को नहीं है, इसको फ्रेलिटी है, इसको नहीं है, ये फ्रेल होने जा रहा है, it's in a pre-frail stage, or it's in a pre-hypertensive stage, or is getting into anxiety. This is so true of COVID times. So I think those things need to be alerted, and the personal plan. If I have this solution, and the elderly person should be able to take that decision. So should be very comfortable with the health system, very comfortable with care system. If I have, so it should be walkable distance, as just said, that you can walk up and kind of take help. And if you need more help, then you have to take support of families. So I think those are the algorithms which need to be worked at, and provide a positive enabling system, including real-time updates. And so if you are with the doctor, now it's happening with pregnancy, this is your 2nd week, this is your 3rd week, this is your 30th week, you now do preparations like this. So there can be certain alerts. You are able to feed your data. Today blood sugar has raised from 145 fasting to 175. So there should be a real-time updating, and the doctor can give you there could be monitoring system, medicine monitoring system. So I think with such a large population, the access has to be at doorstep. Cannot certainly spring up with splash of hospitals, splash of medical systems. Then it is not seamless. It is the person is able in moving that. And definitely we harness technology. You need to have the apps. You've just done COVID apps, and many times these technologies don't work, but they give you a kind of thing that you have a technology. It might be worrying also that somebody is mapping you, but that's besides the point. That's a double edge. But it should be a friendly, positive, enabling system is something which I would reiterate. It should be constructed in such a way. The Western countries, the elderly have a home visit weekly. Somebody comes for blood pressure, blood sugar check, and general dental care and whatever. And then they say, okay, your assistance hours, home care is 2 hours per day. We are increasing to a 3rd hour. Somebody else will also come and massage, and somebody else will come and give you a good bath. So, there are these systems which make things a little better. We don't see this kind of assistive system here. Somebody can assist you with groceries, domestic support, care, companion hours, and we are completely not like this. Not that I'm saying that it will work. I think we need a strategic plan. Do we work on this model, or do we not work on this model? and are some of the initiatives we must plan what we want in India. In India, initiative, sorry, I've lost the last point. In India, the initiative by police very recently in COVID time was exemplary. The local police station, they had they generally have a list of all the senior citizens, and they make a fortnightly visit that if a senior citizen feels secure, even if they stay with family, they come and give a chat, take care, they put a tick mark. But during COVID time, if the family was not there, the daily help was not coming, the local police station was doing, community cooking just for the elderly, that particular chapter in the police station to look after elderly. They did it very well, and they did it almost for 4 or 5 months without any problem, that most elderly people felt very secure, really very secure. So I agree that generally elderly during these times, especially in the urban system who got these supports, were very secure. But there were a huge number who were deserted by the family, they didn't have income, so there were other confounders. And so they were in pathetic state. They lost their house, they lost the family, they were thrown out on the street, they were dumped in the middle of the road. So I think all kinds of stories you find, which is quite obvious in such a large country, but such situations should not come if it is planned by state. Next. There is a WHO guideline on integrated care system. So WHO guideline in integrated care for old elderly people called ICOPE was well established by 2017, and they propose evidence-based recommendation for health care and slow and reverse the decline of the physical and mental capacities of old people and achieve universal coverage for all at all ages. So that was, there are several guidelines. I'm not detailing it here, and those who work in this area can look for it in the sector. They are very keen. It's a huge comprehensive guideline and helps health system for healthy aging and maximize older people's intrinsic capacities and functional I've lost the screen. Yeah, it's come back. So functional ability, there is a ICOPE handbook, which was launched in 19. It came up in many, it was intended to come in many languages, 2020. Not all languages have got covered. This is world over. And ICOPE app, which is adopt a health policy, train, clinical guidelines, engage local health systems and capacity. These words are enough to string up what I have just said and what has been said by my previous speakers. Next. And I think that's the last two. So this is personal nutrition and health. And Preetiji made such, lucid presentation and talking about, the individual food groups and the dietary guidelines and the health guide and the guidelines in terms of nutrition and health. And health-seeking behavior, routine monitoring, check BP, sugar, urea, creatinine, protein. There should be some certain minimum things that should be done. So people should know that I need to maintain my diary. And they should have lifelong learning, use of technology, app, they network, monitor, engage with their doctor. And they should feel comfortable. They have a doctor on hand. They have another professional in hand. So it should be in their hand. And nutrition, special emphasis to fresh, antioxidant-rich diet, freshly cooked, eaten within 2 hours. That's true of young people, and maintain the cold chain and food safety, and have a diet which is rich in milk and milk products, primarily because of protein. And if you don't want milk, you can have a high pulse diet also. So there are various sources that can be tapped to meet the protein requirements, calcium also, and daily 400 grams of fruits and vegetables. This is the one which takes a maximum hit. It requires the hand-holding of state to keep the prices less accessible to local communities. So there are a host of issues, and there are ICRIER documents how to ensure 400 grams of fruits and vegetables to the young population, how to encourage in adolescents, in elderly and all age groups to prevent NCDs. So there's a shift in the population to junk food. So one would not have that. There has to be a positioning of these food groups because they are very protected. Physical activity needs to be promoted. Now people have become very, very serious about it. A lot of people are able to do yoga. They do not go out. They do not walk because of poor walkability index on the roads. Traffics earlier, pandemic time made it easier, but then 60 plus was told not to go out. However, there can be a personalized regime of physical activity, and no exercise is better than the other. This is aerobic, this is endurance, correct. And there should be a good mix of how you take it. You can sit on the bed and stretch and do stretches and endurances and take dumplers and take the weight so that your muscles of the arm and the leg and the gross muscles don't deteriorate. So then that can be worked at. And if none of this, then probably massages were done traditionally. So I think these are very, very important, and most young people do not value this. So when they do not have these values in young, they do not have it in old age. So this needs to be learned by the elderly themselves. They will be able to do personal care, but you need to orient them. You need to give them, these are the things you must take care of, and these are your doables. So bone density, if you're interested in frail and frailty, frail and falls, you have to see that the young person, when he was in youth at 22, collected maximum bone mass. The BMD was high at 22. It is highest in the life cycle. And that's what I say, that when you do strategic planning through artificial intelligence, you peg these points. And then you say, if there is a 10% loss, you will maximum reach here. If there is a 40% loss, you will reach here. Body potassiums lose like this, and calciums lose like this. So by the old age, if you have this much, then you will not have so much of problem, which is orthopedic. So I think these are things to be learned. It requires systematic care and guideline. But once the guidelines are made in state, then it should be a doable algorithm for them. So maintain good health, just sit in the sun for 10-20 minutes, have a good calcium diet and a protein diet. So that's just about 4 things which make sense for this. Walking, swimming, you'd be surprised that people at 90 take on to swimming and they lose all their body aches, all their arthritis and ligament looseness and hydration of the muscles. So, there are, but for everybody, it doesn't come well. If you didn't learn swimming early, then you can't possibly swim at 90. So most of these efforts should be a personalized plan, well planned out, well chalked out. This is going to help me till old age. These are the things I have to do because it's going to keep me healthy. This is the phrase we use. Most people peg their goals like this. And the barrier-free environment and decors at home, not too much of things here and there and cluttering up and then they strip and fall. And generally, the walks should be earmarked, the paths should be known, they should have a high walkability. We do geo-mapping, and it came to know once that certain sections of Kerala and certain sections of Punjab, like Chandigarh, will have a very high walkability index in India. Delhi, Paharganj is the worst in the entire country. So, so there would be certain things. You can't possibly go for a walk in a station in the background and a marketplace. You need to have your path well defined and with minimum number of people to prevent a fall or disturbance or noise. And they can sing, internalize their own music and walk carefully. Last, I think. This has been just said by Dr. Hegre, which is social and mental health. You must talk, have one meal. You must generally be gregarious, maintain your social circle. So I think generally to have these peg points like I must talk to my children daily. Now, many of them, they stay in the same locality in a different flat, or they stay in Bangalore, or they stay in America. Now, wherever they stay, so long they are not in the same room, you must have a strategy to talk to them daily. So 10 minutes, 15 minutes, that is mutually decided. And how they talk first, you talk first, immaterial, just talk. And that should be a peg point. Maintain a good social circle, meet frequently, go to clubs, you can have traveling groups. I know some people from 70 to 80, they travel internationally every 3 months. They pick up a charter flight and they are all out. Most people from Europe, after they retire, they are on a traveling spree. So these are certain good things. And if you can do it, that's really very good. And they have their own circle within which, and the well-known travel agent. So this is generally to say that this is very urban. But if you give a rural one, then probably your own vicinity ladies in the neighborhood, and they go to the local health clinic. Take their daughter-in-law for a medical checkup and sit around there and chat. So that's just about fine. So maintain productive work life. So here I want to really say that when you are gregarious and you make rules which become barrier, and you feel cheated and you feel exploited, I mean, these negativities should not come. And I therefore, in 2 slides before, I said positive thinking. So there is no rule of the game. The rule of the game is, at the end of it, you lead a joyful life. So that is the rule of the game. So I think it needs to be told that if you have these mental barriers, just shed it and maintain productive work life, whether you work in welfare associations of your colony or a health clinic in a religious place, besides the point. But you open a library for all the adults and children in the neighborhood, and they come and they chat with the uncle and they use the books and they have a discussion point. So you can have a study circle, home base. So maintain your own plan. There are many ways to do these good things. Listen to concerts, discourse, chant, social recreation gathering. Maintain a disciplined lifestyle with a routine. Minimum vicissitudes in life is very important. Every day it's a new challenge. Now that can really take a toll on your health. So that should be told to the elderly, that make a fixed routine, and you must talk 1 hour in the evening to a friend, 1 hour, half an hour in the morning with your children. So there is a routine in which you follow, and minimum eating out and maximum social circles. So even if you go out with your friends, just don't go on eating and putting on weight. So that is very important. So when you go out, there are many healthy ways of going out with friends. I think this is the last. So this is a summary slide. It says, look out and communicate some of these messages. We are talking about Atmanirbhar Bharat. We always wanted that, if you ask any elderly, they don't want to increase the dependency ratio. And therefore, this Atmanirbhar Bharat is as much true for elderly. They need to internalize and strategize themselves. They need to shed dependency. 60 plus is the best stage in life, and people have great going till 90 plus. They maintain orchards and they go on marathons. A lady in Patiala actually is a marathon runner. Somebody in America is a person who migrated from India and runs orchards in California of fruits. And they should be able to be a prolific reader, do research, do innovation. At 90, I find certain American professors, they go to the university, they spend the whole day together, do not subscribe to the coffee club, do not subscribe to coffee, but they do not leave their club. So I think these are certain things. So just shed the dependency. Don't have this barrier. I'm 80, I should not go to my workplace. I cannot go to a library. Just shed these barriers. If you love to do it and you can do it, just do it. And look after health, look after friends. They will look after you, you look after them, and learn a new skill, technology every day. Have a personal plan and lead a disciplined life is the final mantra of COVID. Will come and go. There could be many more other challenges, but we have seen that elderly coped very well with some of these observations, and I learned it only from their own lives to give them back that these are some messages, doables, that can be drummed daily in your own chat circles. Thank you.
Thank you so much, Dr. Sidhu. From our chat box, so many. Thank you very much again for this most all the details by our 3 speakers. I would like to present in my as associated with the IWAFA, what it looks to be the way forward for this session. It's been a valuable session. It's very clear from our speakers' presentations that there are serious issues of malnutrition, nutrition, and health amongst the elderly. A number of prescriptions, dietary tips, lifestyle, habits, state of mind, capacities, hobbies, eating well, avoiding risky behavior, everything has been spelled out. Our speakers have also spelled out the formal national program for the health care of the elderly, the convergence with the National Health Mission, and the package of services from the sub-center to the district level that could provide individual services to the elderly. At the tertiary, national, and referral level, also there would be a number of services which would be there in the larger districts, larger cities, larger metros. But all this would require proper implementation, which I'll come to. If we do achieve this implementation, that multidisciplinary clinical services that the elderly require and that have been spelled out as a sine qua non of healthy aging by our speakers could be achieved, and the risk mitigation habits could be cultivated. Speakers also spoke of the concept of active aging, preparation for active aging, failing which dependency ratios would go up, and there would be all the problems that have been spelled out by our speakers. A very valuable session on mental health, the issue of the mental health increase in the pandemic, and the very, very comforting news that the wisdom of the elders of India more or less mitigated the damage to a certain extent. But of course, there are telltale signs of depression, which were spelled out so well, the concept of psychological age, and the challenges that face the elderly today on account of the social occurrences that have happened, the breakdown of the family system, etc., and the financial and economic challenges. Very rightly, depression has been called the elephant in the room. Thank you, Dr. Hegde, for telling us what are the telltale signs and the early warning signals. All this
Rita, ma'am, you're not audible. Rita, ma'am, I think Ms. Rita Menon has logged off. So continuing with it, I'll quickly take you through the pre-webinar survey so that we can quickly get on to the questions. We did a pre-webinar survey through our registration forms, and we got about more than 210 responses, but this is collated to 210 responses as of now. So most of the participants felt that yes, 61.8 participants felt that in the post-pandemic world, elderly and the frontline workers would be the ones who would be suffering, encountering more issues related to health and nutrition. Can we move on to the next slide? Due to lockdown, what all issues have impacted the mental health of the workers, of the elders, and about 75% felt it is social isolation, and about 62.8% felt it was a less physical activity, and 16.8% felt increased violence. Next. What could be the issues that in the post-COVID encountered in a post-COVID world with respect to health and nutrition? So these are the responses that we have got, and majority of the people felt that it is a mental health issues of socially isolated, fear, depression, and cognitive disorder. Some of them also felt that costly healthy food items would be, we will be more they will be the food will be more costly, and there will be reduced access to daily nutritional requirements and health facilities. Some of them even felt that there will be allergic reactions of the vaccine, and there will be low vitamin D levels of the elderly. They may not be able to maintain good status and may get involved in overeating, and they will have low immunity. So they need extra nutrients such as calcium, iron, protein to enhance their immunity. So these were some of the answers. Can we quickly move on to the next? And we also asked what are the ways that participants can suggest us for, I'm sorry, I'm unable to see it, ways to encourage the practices for the elders in the post-COVID world. And most of them felt that, yes, proper diet, regular exercises, yoga. Can we move on to the previous slide? Regular visits by volunteers to look after their physical and nutritional needs. And they also need for mobility with assistance. They also felt that we need to follow the government guidelines, and to ensure healthy practices, we have to formulate policies and initiatives. And they also felt that we need to form pocket groups or NGOs who will organize aids for the elderly near them. And definitely connection with surroundings, nature, family, and neighbors were some of the responses that our participants had given. Well, most of the participants also tell that they will look forward to this webinar for, demystifying their queries. So moving on to the question and answer round, we received a lot of questions, but in our registration form, but I will be taking a few. So my first question is to Ms. Preeti Sudan ma'am. Ms. Preeti Sudan ma'am, can I ask you the first question? Okay, I'll take on to the next. Yeah, please.
Yeah.
So, ma'am, the question is from CA Kalpana, who is an associate professor at Coimbatore, India. She wants to know how to focus on the health and nutrition of institutionalized and non-institutionalized elders.
So I think as far it is easier to focus on health of institutionalized elders if the staff there and if the the protocols are in place, because they are in one place, they are institutionalized. We should draw out a daily diet plan. We should ensure that they are given nutrients as per, and there could be individual requirements because of diabetes and because of BP and other NCDs. That's as far as institutional is concerned. But then again, though it is easy to ensure that in uniformity of nutrition, however, the quality of nutrition depends on how well trained the staff is, how sincere they are, what is the oversight mechanism, and how they are being supervised. That is as far as institutionalized is concerned. As far as non-institutionalized is concerned, there could be elderly who are alone. For them, it is really a challenge because you see, cooking themselves, or if they are well resourced, if they are well endowed, then they can, they will be better off. But for the elderly who are below poverty line and all, it's very difficult. But I suppose it is community, intervention that is required there, maybe through the panchayats, through the we have seen that the women have, so maybe we should now starting of elderly self-help groups. And as far as elderly in families are concerned, I think Dr. Anupa has very nicely sort of touched on those issues, and we have said that the sensitivity, the inclusion, all best thing is to have a diet and community eating at least once a day, as Anupa said, and as I also mentioned, will help. Thank you.
Thank you so much, ma'am. We have a next question from Ms. Tina, who is the program director from PPHF Delhi, who wants to know what could be the best strategy to strengthen public health program for the elderly.
As I said, we do have strategies. You see, there are two things. One is policy, next is strategy, and the third is the intervention itself. And then what is the quality of intervention? So these are the main things that but as far as strategy is concerned, what is for example, the LASI study, as I told you, that has indicated what is the what are the challenges of the elderly. Similarly, when we come up with NHFS data, and we will come up with the census data, that will also show where we stand as far as the elderly is concerned. So strategy should be based on evidence, and strategy is also based on observation and also on experience. So in my view, these are the ingredients which make a good strategy.
Thank you, ma'am. And one last question, that is from Ms. Shruti, a student of Delhi University, who says that soon enough the vaccine for COVID-19 would be available to general public. What would you say to an older person who is apprehensive about the vaccine and fears it could harm them?
So first of all, I would like to tell you that all these vaccines are under emergency use authorization. Okay, they are not under universal immunization program yet. Number one, that is why the prioritization has been done, and secondly, also that they are being given under government's oversight. So every person who receives vaccine, and Abhito, it is only the the health professionals and now the workers who are receiving. Once they get their shot, they are under observation for half an hour. And they are every person is being, adverse events are being reported. So therefore, when to the elderly, to plus, and then people with comorbidity, I'm sure the government, and it's already also stated, all the risk factors will be very, very clearly told. So we should observe those and go with the government guidelines.
Thank you so much, ma'am. My next questions are for Dr. Anupa Sidhu. Ma'am, can we have?
Yeah. I'm trying to get back to the original screen, but do ask, yes.
The first question is from Aisha Gaur, student of MSc Food Science and Nutrition from Lucknow. She wants to know what are the key points we should keep in mind while planning a meal for elderly people.
I think Preeti ji said so well, plenty of water, fluid, fruits and vegetables, freshly cooked meal. It should be dental soft. So these are, not too much of cereals, not too much of sugar, not too much of fat, and basically freshly cooked. And sometimes there are certain associations seen with food. I don't like to profess a single item basis, but things like Alzheimer, forgetfulness, associated with coconut oil, fortification of meal or a supplement, and fish, as I said earlier. So there are certain things which people feel solace. They feel the association that it works. It requires research. It needs to be known. But generally, a balanced meal, all food groups, food diversity, at least 5 to 6 types of different foods included in a daily diet, not just a simple porridge or a dalia or something. If it is dalia, then with a little bit of carrot and fruits and vegetable in it. Definitely to minimize fat intake. Too much of cooked may not be good, because at least in India we cook with a lot of masala, and said in certain parts of the country that we fry water also as a tadka. So maybe too much of these extra seasonings and fat need not be added. And with age, you need to have a reasonably neutral kind of a thing. But if somebody likes a very spicy meal, there is no problem. It should agree well with the person. I remember Dr. Waterloo is no more. He would have been over almost 100 now. He came to India to attend Asian Congress. of nutrition. And he told that, please, in Ashoka Hotel, please take me to the South Indian meal section. And he selected, the spiciest of dosa, which had red chili dash. And I said, James, John, will it agree with you? And he says, I want to make this agree to me because I want to eat it. So I think that, so you need not overdo. So you should eat everything. I would never say, don't eat this and eat this. So I'm not talking single foods. It should agree with you. It should agree with you on a daily basis. It should agree with you sometimes basis. You take a personalized plan on that, but do not deviate beyond a point. So don't overdo these choices of spicing. So I think water and things like even beverages, generally they reduce coffee intake, tea intake with age. Some of them actually increase it. So there are certain things which goes with the choices of the person, and that is paramount, what agrees well and keeps the spirit on. And at the same time, it should not be excessive spice, excessive heat and temperature, very hot meals, very hot beverages, very cold beverages. So there are these general guidelines, yeah. Hello?
Yes.
Thank you, ma'am. The next question is from Mr. Pankaj Kumar, a teacher at Sainik School, Purulia. He wants to know, could you suggest some healthy diet plan tips and precautions for the elderly people who live in village with limited resources in the current times?
So you would be surprised to know how I look at it, having first-hand experience of both rural and urban. As I said, my master's thesis was nutritional status of elderly in rural and urban. So the rural ones were amazingly great. They drank matha, they had a meal once a day, they pulled out carrot and from the field and pulled it out and munched it up. And those were the excellent things. One may think that they are impoverished. They are not. In many ways, they are better, and they eat absolutely natural food. And if they grow organically, even better. At least in late 70s, they were not putting too much of chemicals, and at least the village that I visited, and they were consuming fresh milk products and like matha. They didn't consume whole milk, you would be surprised to know. One may say that they would like to sell ghee, but I think other members of the family were keeping the ghee. The elderly people, and these elderly people were people who retired from army life, actually. So they retired and went back to village, and a village was with such a demography. I mean, I didn't select it like this. And the urban people were also, I mean, those were defense colony people. So those were again army people. So in that case, they were reasonably well matched. They had a very disciplined method of consuming, and I didn't see obesity and their skin fold thicknesses. And I tried to draw a graph on what is excessive skin fold and what is less. And this was an extremely well thing. So from my personal experience, I don't see rural elderly being at any great disadvantage, and they were gregarious. They generally watched their grandchildren play in sand while they would be on a hookah. I know they should not consume abuses, the tobacco, but they would generally be on the khatia and look at their children and feel very good about it, and they kept very good age. So the eldest, senior most person in that community was 93. And same was true of urban. The senior most person at that time was 87, but we were not doing it age. It so happens by the sampling method, it came out like this. So I have great hope on elderly people in rural India, provided they maintain, just look at the robustness. They can take any heat, any cold, anything. They could be on the road, and they are very strong collectively. So from the world over, it is known that countryside people, they are all together, they dance in the evening, and they maintain extremely good spirits and health. It's only certain sporadic people, they lose mental health, etc., when they suddenly create barriers for themselves. It is not due to age that they start feeling depressed. They feel depressed because they construct barriers. It's a mindset that needs to be kept open. And rural India, those opportunities are large. But when they now see unemployment among youth and their young adults in the family, so that breaks them, that breaks their spirit. So there are many more confounders in terms of quality of life of the rural or urban elderly. And but the scope is as much. Life gives great opportunity to enjoy and have a joyful life. Yes.
So, ma'am, the next question is from Muskan Tuli, a student of Delhi University. She wants to know, will there be a need to modify nutritional requirements for elders after the pandemic?
So the best part is in September, during pandemic time, National Institute of Nutrition and ICMR have brought out a document of requirements. Earlier, they actually used to bring out document on recommended allowances. This time, they have been very, very stringent on actually giving for the first time a document on requirements and not allowances. And so I don't think so. There is any change. The human body remains same. With age, certain utilizations change, and just by physiochemical properties of diets, just by having a well-cooked, easily digestible diet, so you are still able to. You don't have to eat any extra or less. So for certain vitamins, the requirements increases, and certain lifestyles ensure very good health. So balanced diet, sunshine, vitamin D, calcium, and calcium from all ages, not just old age. So broadly, with age, requirements do not change. They change very little, but with comorbidities, you require supplements and reducing diet. So there are, because lifestyles and comorbidities bring about this change, therefore the requirements change. And so this ICMR book is not meant for requirements during disease. So you cannot decipher much from that document. That document is for normal people, and for any other therapeutic changes and recommending multivitamins, etc., should be under medical prescription only. Yes.
Thank you, ma'am. My next set of questions is for Dr. Soumya Hegde. So I will ask when you're ready, Soumya. So, hi, Soumya. Do we have? Okay, I think.
She was present. She was present. She had joined back.
Ma'am, she's not in the participants list.
Okay.
Okay.
So the next question, somebody has asked, would like to know what pension is available to old people in the informal sector. I would like to say that we are going to answer this query in our next webinar, which is on strengthening the present and post-pandemic effect, economy and livelihood of elders. So with this, I think we have come to an end of the question answer round, and I would like to hand over to Ms. Rita Menon.
Thank you very much, Dr. Mayanka, for ably handling the large volume of questions that we got this evening. I would like to acknowledge the very, very great support and mentoring by Mrs. Sarla Manchanda, executive member of the executive committee member of the IWAFA, Dr. Adarsh Sharma for her valuable inputs. She's also an executive committee member of IWAFA, and Ms. Asha Ahuja, our administrative, was very, very forthcoming in answering our queries and getting together a lot of work that had happened. I also would like to acknowledge the very precious work by the interns, Palak Sharma, who did the e-design, Palak Khanna and Srishti, who did the marketing and technical support for this webinar, Yashika Malhotra, the research intern who put in valuable hours, ideas, and writing, and Manish, Japleen, Anmol, and Simran, who are our report writing interns, without whom this webinar would not have been possible. Our friends, we are truly grateful to all our panelists and guests for joining us today. In case you still have some queries, do send them to the IWAFA office, and we will attempt to get questions replied from our speakers in case they have the time. Please also fill up the feedback forms shared in the chat box. Your participation would entail that we would send you by email a certificate of participation, and we can then fully target your needs and ours in the other webinars to come. We have one final upcoming webinar on 13th February 2021, as Mayanka Gupta has just stated, which is on the subject of strengthening the present and post-pandemic response with respect to economy and livelihood for elders. Friends, this is an extremely important seminar with consequences that have a spin-off effect on health and nutrition. This webinar would be held again between 5 and 6:30 p.m. Indian Standard Time on the 13th. Details of the webinar will be available at the IWAFA website. You can follow us on all the social platforms as well. Above is on the screen is represented the next webinar's design and the array of very eminent speakers who are going to speak on the subject. So see you then next week, and thank you all once again for being with us for close on to almost 2 hours. And till then, stay safe, stay well, God bless, and thank you for supporting All India Women's Education Fund Association. Good evening.
Request all our participants to please fill in the feedback form. We will not close the meeting. We're done with the feedback form and you receive the certificates.
Hey, Eddie. आगे certificate.
Hello. Hello.
Mayanka, are they coming in by mail or on the chat box?
Ma'am, they will come on the mail, on their mail, because they will be filling in their mail IDs in the feedback form.
Okay.
I think within next 5 minutes, since we had already put in, within next 5 minutes.
No problem, no problem. I'm with you to handhold you till the end.
Okay. I think all of us can switch on our videos for a pic, for a screenshot.
Mayanka, have the forms come in?
Yes, ma'am. A lot of them are filled. So I request everyone to please switch on their video so that we can take a screenshot.
I'm on the phone, you know, the laptop, I don't know, the Cisco WebEx gave up at the right at the end. So I switched on to the telephone. Is Asha there?
I think Asha ma'am logged off, I think. Chitra ma'am is there. Hello, Poonam ma'am, how are you? Ma'am, you are switched off, muted. Poonam ma'am. Hi, Chitra ma'am.
I attended the whole thing, including the question answer session. Very, very nice session. Very, very good. Thank you. Thanks to everybody, the speakers, and for you for organizing. Thanks, Mayanka.
Thank you, ma'am.
Mayanka
So we
did
can
a
have,
great job.
so we can have a screenshot.
Le lo.
Yeah. So Shrishti, can we please take a screenshot?
Ma'am, we have taken. Thank you, ma'am.
Yeah. Thank you. Thank you everyone for joining in.
Thank you once again, Mayanka.
Thank you so much, ma'am.
Great work done, Mayanka.
Right, it was done right today.
It was okay in your
Yes,
opinion?
ma'am. Yes, ma'am. It went well. I think a lot of positive comments from in the chat box.
I saw that.
I think the sessions were informative and they really liked the speakers, presentations.
Lovely. Very nice. Very nice. Okay, then I log off.
Yeah. Yes, ma'am. Even I'm logging off. I think we are done. Thank you so much, Rita, ma'am. It was wonderful. Yeah.
Bye. Bye.
Bye, ma'am.